A code of ethics is provided as a set of written guidelines supplied by an organization to help people promote their actions in agreement to its primary values and ethical standards. The Code of Ethics of the Philippine Physical Therapy Association was ratified on November 26, 2000. And it collectively acts as a basis of the practice of every platinum professional in maintaining their highest ethical standard. It serves as a guideline to professionals. It provides a consensus within a profession enabling practitioners to work cooperatively and to compete fairly. It gives support to responsible professionals who are faced with dilemmas. It serves as the official statement by the profession in promoting public good and minimizing harm. And lastly, it promotes public trust. Article 6, Responsibilities to other physical therapists, refers not only by being professional in terms of work-related issues but as well as being able to work towards the betterment and well-being of the patients under your care. For example, 2 physical therapists are needed for an inpatient in the ICU. Although you aren't familiar and you heard some gossip about the new platinum assigned with you for that patient in the ICU, you don't only act civil or professional towards her despite the rumors, but you both work hand in hand for your patient's well-being. Share knowledge and experience with colleagues. May it be in a private clinic or a hospital setting, it is expected that you work harmoniously with your colleagues by means of sharing your knowledge and experience, whether it be about your personal encounters regarding a certain patient or seminars you went to in which you gained a lot of new information about a new case. For example, as the newly appointed chief therapist in the rehabilitation department, you are in charge of all the therapists under your department. It is expected of you that you will be able to guide everyone, most importantly the new therapists who are usually fresh graduates with zero experience regarding on the patients they have been assigned to. Ensure proper endorsements if physical therapy leaves. The patient should be at the apex of the priorities, and when the platinum leaves, it is his/her responsibility to make sure that necessary documents are given to the succeeding therapist. Proper and accurate endorsement notes guide the therapist in administering correct interventions. A well-endorsed patient helps build trust between patient to therapist and build camaraderie between co-workers. Irreconcilable issues should be referred to competent bodies. As a part of healthcare community, a sensible physical therapist must be knowledgeable of the limitations of his/her field of practice and jurisdiction. This section refers to situations which are beyond to the faculties of a therapist. An example of which is a conflict regarding the attendance and punctuality of the employees which affects the treatment schedule of a therapist's patients. In this scenario, a single therapist cannot impose a rule or demand to his/her other co-workers to be earlier, thus it would best to refer the situation to the chief platinum or someone who governs the staff involved to properly address the dilemma. Observe utmost caution, tact, and prudence regarding the professional conduct of other physical therapists. A physical therapist must uphold this section as a duty to his/her co-therapist to show professionalism and respect to co-therapist's skill. If violated, it can cause damage to fellow physical therapist's reputation as a professional. Personal issues must not be brought to the workplace. For example, it is not correct to share doubts regarding co-platinum's skill to patients or clients, as it will not be able to resolve anything. A physical therapist who has good intentions should have addressed the issue directly to his/her co-therapist.